for 30 years, they've been shaving off one service after another. I mean, if you go into a hospital these days, it is frightening how dirty the hospitals are. It's frightening how much things like MRSA and hospital-induced disease and infections are that they can't even control. Because they took the workers who were trained and skilled at cleaning a hospital, and they brought in the cheaper ones that are cleaning the office buildings downtown, who don't know anything. They just come in and dust around, and they're not trained. It's not the workers' fault. It's that they're being asked to do something that they weren't ever trained for. So you've got that, and of course there's a whole fight against the unions, because you take those workers out of the hospital, you've now gotten rid of AUP workers, or operating engineers or somebody, and the same thing happened with the laundry services. It frightens me. Up here on White Avenue, go and have a coffee and watch the truck pull up and go in and collect all the laundry from the hotel, and then it goes down the street and collects it from the U of A, and all the infections and everything get all mixed up into the hotel laundry. So you don't know, when you go into a hotel, you don't know where the sheet's been before you met it. Like there's a serious problem. Again, to save money, and yet all our hospitals in the 80s were all built with these huge, big laundry services. But again, cheaper wages, get rid of the union workers, weaken the unions, and the services are very bad. I mean, we've had horror stories told about what people have found in the laundry. Yeah. So that was another one. And then they tried to replace registered nurses with what they called licensed practical nurses, but what really they were talking about was nurses' aides. So if you're an immigrant and you hardly speak English and you've only been here and you have no skills, come and work in the hospital and take care of our sick, because we're saying we don't need these skilled people. Again, it's the tearing away at what was the strongest union in the province with the nurses, and they were systematically, 3,000 were laid off in 1993. And it's funny that under Ron Liepert, we had a deficit of 3,000 nurses on a Friday night, and by Monday morning we had a surplus. Like, they just spin it differently. And then they started the freezes. Like, this is totally frightening. Those nurses are working huge overtime hours right now, and they're all in their 50s and 60s. There's a whole chunk that's going to be retiring very soon. And then who is going to? Because we're not even hiring. We haven't been up until this latest change of the head. We're not hiring the new grads. They're going elsewhere. So it's like shades of 1993 again. A friend of mine here in this building was an LPN in Manitoba, went and got her RN, and graduated as an RN in 1993, and couldn't get a job anywhere in Canada, because they were doing this elsewhere, but particularly here. And so she went to Texas, great place, and was on the Texarkana, the Texas-Arkansas border, and she was treated like royalty. They were given extra wages. She's back here now working in the Heart Institute at the U, and all her skills are a la what she learned in Texas. And it was Texas' gain and our big loss. And a lot of those nurses haven't come back.